Up next, Metrofocus. We're working from home, but we're dedicated to bringing you the important stories about how our area is affected by coronavirus.
This is Metrofocus with Raphael P. Rahman, Jack Ford, and Jenna Flanagan. Metrofocus is made possible by James and Merrill Tisch, Sue and Edgar Wackenheim III, the Sylvia A. and Simon B. Poida Programming Endowment to Fight Anti-Semitism, Bernard and Irene Schwartz, Rosalind P. Walter, Barbara Hope Zuckerberg, and by
Welcome to Metrofocus. I'm Jack Ford. For weeks now, as we've combated the coronavirus pandemic, we've been besieged by stories of tragedy and great loss and hardship. But there have been some inspiring stories too, and stories about selflessness, about sacrifice, about caring for others, by people who once described by Abraham Lincoln as the better angels of our nature. Our next guest is one of those better angels. Dr. Alexander Salerno is an internal medicine specialist and a primary care physician who for decades has provided care for the underserved in New Jersey. Became so frustrated by the difficulties he was seeing in terms of testing for this underserved population that he decided to take things into his own hands, quite literally, and into his own wallet, quite literally, and create a pop-up clinic that would travel to different locations and test literally hundreds of people a day, people who had never seen the inside of a testing lab. We are delighted to have Dr. Salerno joining us now, our conversation, part of our Chasing the Dream initiative on poverty and opportunity in America. Dr. Salerno, welcome. Thank you so much for joining us.
Thank you, Mr. Ford.
Let me ask you to give us a sense of this frustration that evolved here. And as I mentioned, for decades now, you've been providing care and treatment for members of the underserved population. What was it that made you finally say, I've got to do something here?
Well, it kind of started when this whole pandemic began, Mr. Ford. I mean, my frustrations have evolved from not being able to get PPEs for my staff to not being able to get testing kits. I mean, the biggest challenge in early March and probably right up until the end of March was having to ration who can get tested and who cannot get tested. I mean, that just was not anything that I was raised in, that I had to ration care. And so we didn't have swabs, as you know. And so without the swabs, we couldn't do a testing specimen. But then we got swabs and we got lots of them, and we were able to test, and we started testing, when we created pop-up tents at our different locations. Department of Health was sending us folks, first responders were coming to us because it didn't seem like anyone was testing. I mean, if you needed testing, it seemed, odd, but you had to go to an emergency room to get tested, or you had to go, miles and miles and be in a 4-hour car line to get tested. And that only adds more frustration to what's already a frustrating situation.
Right. So tell me how this whole idea evolved. You talked about the frustration, the backdrop of frustration. But for a lot of people, they remain frustrated but aren't able to do much about it. You decided to do something about it. How did the idea evolve to create these pop-up locations?
Well, actually, the idea started because I thought of an ice cream truck and food vending trucks. And
that's great.
In the urban areas, there are lots of ice cream trucks and there are lots of food vending trucks at the public parks and at the basketball courts and at the public pools and just in general. And so it's part of the culture of the urban area are trucks. So now we're not going to have, unfortunately, it looks like ice cream trucks and food vending trucks. So I was like, okay, why don't I fill the void and bring a testing truck? Because it's not like brick and mortars, you build it and they will come, especially when a lot of people, they can't commute, they don't have means of commuting. And so I just bought a used Sprinter van and retrofitted it. And within about 2 weeks of buying it, and went on the road. And this is our second week now on the road.
You mentioned the ice cream trucks. I grew up part of my youth in Jersey City. So I remember vividly, the sound of the ice cream coming down the street and how it was the highlight of your day, obviously. So to see that parallel for you saying, well, it works in these urban areas to provide some relief in ice cream. Why can't we use it otherwise? Let me ask you a question. We've heard so much, especially from the medical folks, about additional layers of frustration caused by bureaucracies and red tape and rules and regulations that had to be followed. Did you run into any problems here in terms of you saying, look, this is what I'm going to do. I'm going to take this on the road and I'm going to make sure I get to as many people as I possibly can?
No, I mean, but, there is some, fact to what you're saying about the bureaucracy and analysis paralysis, I'd like to call it, with, a lot of government officials. And, it's kind of like layers of an onion. The more you peel, the more you cry. And so with certain areas, I hit a lot of bureaucracy, and in other areas, I really did not. For example, the city of Orange was great. Mayor Warren really it was a phone call, and within 3 days, we were up and running. So I don't think right now, and as you can see, there's been a lot of relaxing of government, governing principles. Like HIPAA has been relaxed quite a bit right now. I mean, telemedicine has been expanded. Telemedicine now is even expanded that, a lot of folks don't have smartphones or computers, so you could do telemedicine by just a phone. So we have eased up a lot of things, at least federally, it seems like, and the insurance companies, they eased up the idea of, you could only see your primary care doctor. We can see anybody now. You don't have to change your doctor to come and get tested at our van, So the insurance company industry has bounced and evolved. The federal government and CMS and HSS has bounced and evolved to allow this kind of creative endeavor, But sometimes as you get, further down the food chain, things still can get complicated.
We're talking with Dr. Alexander Salerno, who has quite literally taken his medicine from his medical facilities to the streets in New Jersey, bringing COVID-19 testing to people who otherwise would not have had the opportunity to have those tests done. Tell me about what your daily existence is like. Explain to us all what happens. How do you get to these locations? What do you do when you get there? What do the patients do? Where do you find them?
Well, we have a strategic map set out by the mayor of Orange right now. And so he determines, along with his city council and his senior housing officials, the best places to put the van. So we'll bring the van. For a few days, it was in the police parking lot. Then it went to City Hall parking lot. And then it went to where it is currently, like in a little triangle courtyard between 3 or 4 different senior buildings. So next week we're going to another location. So he knows where the people are, and he knows where we can reach the people. So I'm relying on the city officials who, ideally have the finger on the pulse of their neighborhood.
So
go ahead, sorry.
Go ahead. So ordinarily, if you and I were having this conversation before everything was shut down, and we were not having it in our living rooms, and I was not doing the recording here, and we had editors and producers, we would be weaving in some pictures of where you are and what you're doing. So create the picture for us, if you will, and what it looks like, and when the patients get there, what they do.
So we arrive on a street corner with police support. They block off the area to allow safety because a lot of these patients are elderly, so they have walkers, wheelchairs. So you don't have to worry about cars, going in and out of these blocks. And then it's a Sprinter van, so it has 3 pop-up tents. So the van becomes a 3-room clinic. So 1 room is for registration. 1 room is for phlebotomy, where we can check for antibodies and acute phase reactants. And the other room is where we swab, do a physical exam, get the patient history, and do all the vital signs, including important vital signs like pulse, oxygen level. And then the registration process takes a little bit because we're doing tracings. So we really want to know, what are your risk factors? What's your age? What's your race? What's your comorbidities? What medications are you on? Because we have to figure this out. There's got to be some sort of common denominator as to why do well and why some people do poorly and things like that. So there is some demographics that we have to get as well. And then the test itself, honestly, the swab and blood work, Mr. Ford, take maybe like 30 seconds to a minute to do. And within 48 hours to 72 hours, we contact the patients with their results. And then this added step, in the Department of Health, they only report positive test results. They don't report negative and they don't report antibodies. But I think that's really important in tracings to know who are your naive, citizens, who are your past exposed with antibody citizens, and who are your active, acutely infected citizens. So we gather all that information and then we literally hand deliver it over to the Department of Health of Orange so they can start doing their tracings, because we do know that there's a phase 2 coming, right? So we got to take this information we're gathering now and ideally properly isolate, the right people who need to be isolated down the road.
Give me an idea of how many patients then you've been able to see on each day in terms of this testing process.
So we're there from 8 in the morning till 4 in the afternoon, because there's time that we have to spend, setting it up and breaking it down. So we can see, and we see about 100 to 150 a day at the minivan, or at the van, I should say. At our office sites, which are in East Orange, Orange, and Newark, we see about another 100, maybe a little bit more a day in our outside tents, and then inside we see about 40 to 50 patients a day.
Now, I know you've been fairly modest about this, but I think it's important to note that these are significant expenditures that you've chosen to make on your own. Why?
Well, there's no other way to do it. I mean, when this whole virus, broke out in end of February, early March, I mean, we have a staff of 106, employees and clinicians. My first promise was to them was to protect them. So, we, like most of our country, we were late in getting the PPEs. So the PPEs were the biggest challenge. And so that was the first part. We needed to protect the staff if we have to serve the community. We can't afford to be sick and we can't afford to shut down. And, telemedicine is great, Mr. Ford, but it doesn't work in every neighborhood. And, for a lot of the urban areas, telemedicine is not an option. So we still have to be open and we still have to create a safe environment. So the next thing I did was, I had our cleaning crews work every 30 minutes on the hour, literally wiping down everything. We bought enough 3-ply masks so every patient would wear a 3-ply mask and wear protective gloves as they enter the building. And so we wanted to protect them and we wanted to protect us. So we were both wearing barriers. We were wearing N95s. They were wearing 3-ply masks. And then the van part, again, it just came out of the fact that not everyone could get to us. And I know the area really well. I've been practicing here 20 years. And we've been doing house calls for the longest time for the inner city seniors for about 20 years as well.
Right.
So this is my neighborhood, so to speak,
Yeah.
And
Well,
so I just knew what to do.
Well, I mentioned in the introduction Abraham Lincoln's quote about seeking the better angels of our nature. I think Abraham Lincoln would be quite proud of you and your staff and all that you've done for these people who need your care. So I want to thank you again, Dr. Alexander Salerno. I hope we can talk again a little bit down the road here, and we can talk some more about the bigger picture for this. But thank you so much, and your staff, for the great work that you are doing. You be well now.
Be safe.
Take care.
Bye-bye.